Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We're going to be speaking with Dr. Thomas Slavin in this segment. He's joining us here, Chief Medical Officer at Myriad Genetics. He's board certified in clinical genetics and molecular diagnostics. He's going to talk about how genetic insights can provide better risk stratification at biopsy and how testing can guide treatment recommendations. Welcome to Health Professional Radio, Dr. Thomas Slavin. Thank you.
Yeah, thanks for having me on, Neil.
A bit about yourself and talk briefly about being Chief Medical Officer at Myriad Genetics.
Yeah, so as you brought up, I'm board certified in medical genetics. So I'm a clinical geneticist. Also have a board certification in molecular diagnostics as well as pediatrics too. And I have been in academics really my whole life. So seeing patients, doing research. I'm a physician scientist. I've sat on, many national committees over the years, such as the NCCN for hereditary familial colorectal cancer. I was previously at City of Hope Cancer Center in the Department of Medical Oncology and Therapeutics Research. So I've been around really a focus on cancer, truthfully, my academic career. I was always interested in adult onset disorders and particularly predisposition to those. And some of my later research prior to coming to Myriad was around tissue testing and cancer genomics itself. Mm-hmm. It's been really exciting at Myriad. It's such a great position to try to drive genomics into healthcare. I've been very fortunate and just love the team. We're really doing a lot of exciting things here. For those that have seen lately, we've really just been revamping the company. We've sold off multiple business units to really laser focus down on mental health, women's health, and oncology. And we are, really trying to shore up those three divisions, particularly around collaborative efforts. We've been doing, more collaborations than ever. We just launched more things in the entire history of the company, really, in the last year or so, including a new tumor test that I'll talk about as part of this. We're working really hard to just make it easy for providers to see their patients, really just trying to simplify things, where we announced a big Epic EMR integration that will greatly assist with that. And we're still innovating. We have really been seen as a leader in the biotech industry. We have been one of the first companies in the space. We're now coming into our third decade as a biotech company. So we're not new to things, but, with that, people expect a lot, and they expect you to keep innovating. And we've been really working hard to do that across our business units. So excited to tell you about some of the recent innovations that we've been doing in the urology space in particular.
Well, first tell us how is molecular diagnostics used in urology, and then let's talk about your latest launch.
Molecular diagnostics in urology, it's still in its infancy in a sense. I mean, when we look at data, across the United States, I'm going to specifically talk about the United States, which is, really in a lot of aspects leading a lot of other areas of the world at the moment on the integration of molecular diagnostics into the urology space. But when we look at our space in the United States, we're about 1 in 3 patients undergo some type of genetic test. So, definitely not where, it really needs to be. I wouldn't say that's, that's maybe like a D plus at the moment. So we need to work a lot better to get the genetic testing, whether it's of the tumor itself, to try to figure out aggressiveness of the tumor, or to try to figure out if there's mutations that a patient could really benefit by with treatment of targeted chemotherapeutics, or hereditary testing, which can also sometimes overlap with some of these targeted therapeutic treatments. I mean, this isn't, something that's coming in 2025. This is here now. And it's really been, in guidelines for actually some time. So it's just now really working on that education side of things and raising awareness to bring it into clinical practice is really the standard of care.
You mentioned a new testing suite. Would that be UroSuite, your most recent launch that you were referring to?
Mm-hmm. Yes, that is hot off the press. So, thank you for bringing it up. So really, UroSuite is kind of a culmination of what I was just talking about. So it really brings together, and packages in a simple fashion all the things that a urologist would really need in a comprehensive manner to take care of their patient with genomics and genetic testing. So with it includes one of our leading tests, Prolaris, which is well known to many urologists that are probably listening to this podcast. That is a market-leading test to try to look at active surveillance for patients. So is my patient a good candidate for active surveillance? It's also used to understand if I need to make the treatment more intense in a sense, such as adding androgen deprivation therapy. And it's really been around for about 10 years. With that, we're now bringing in, and we've actually been doing this. We've been bringing in germline component of testing too. So that's more mom and dad genetics. So blood or saliva, and that has a few different aspects to it. One, there's been some clinical trials really looking at particularly people with mutations in genes such as BRCA1 and 2, and trying to match them to a class of drugs called PARP inhibitors. So those could be very helpful for people with prostate cancer that need treatment, potentially with PARP inhibitors. So you really do need to know their BRCA1 and 2 status. And then we also use that mom and dad genetic germline information to understand, okay, why did I get prostate cancer? That's really what people want to know. Why did I get prostate cancer? How do I treat it? And is my family at risk? So that's what all of this answers. So it helps understand why, was someone at high risk for getting prostate cancer prior to getting it? And then if they do, what's the risk for their family members? So are their family members, if they have children, if they have brothers and sisters, parents, are they at risk for cancers? Is the individual with a prostate cancer at risk for other cancers in the future? Say you put that individual on active surveillance and everything looks good. Are they at risk for pancreatic cancer or some other type of cancer that we should, or colon cancer, something that we should maybe be screening for instance?
Tell us what Myriad has done or what Myriad plans to do to advance research efforts.
Yeah, so we've been, really doing a lot, at Myriad over the years in the urology space when it pertains to research. We had a test that I had previously mentioned. We really had to, do analytical and clinical validation around those. Discover them, get them into clinical practice. That's been a lot of research to date. We've had over 30 publications in the urology space overall. Really around these kind of products. We just had a recent one I'll draw people's attention to that I think really gets to the heart of, how to move genomics into practice, particularly around some of the germline space, the mom and dad genetics. That was in prostate in May of 2022. And it was called the Hereditary Cancer Risk Assessment and Genetic Testing in the Community Urology Practice Setting. I'm a co-author actually on that, and we looked at 6 community urology clinics and implementing hereditary cancer testing into that workflow. No surprise that when you actually go in and educate and provide a workflow for providers, it really helps them implement that into their clinical practice. So we really doubled the amount of individuals going through genetic testing after that integration, and about 10% of people were identified with a pathogenic variant in one of these hereditary cancer genes, some which are really important for caring for that individual with prostate cancer for treatment purposes. So, it's definitely, it's out there for everybody. It can be done in the community setting. It's not it's just, it takes a desire and a champion, in the clinic to really implement this. One other really exciting thing we're doing on the research side is bringing in a registry to UroSuite. So individuals undergoing this type of testing, whether it's germline, tumor, as well as the biomarker testing with Prolaris, all that data now will be coming into a registry where providers can access it and look through the data, look at hereditary or hypothesis-driven research questions, and actually be able to put together research and produce publications. So it's going to be really exciting, and we're happy to be able to launch with with data from over 100,000 people pretty soon.
Well, if you would, give us a website where our listeners can get more information.
Yeah, no, absolutely. So, people can go to myriad.com for more information. Also, Myriad Urology at myriad.com is a great email for really any questions, and we will get back to you promptly.
TJ, I appreciate you joining us here on Health Professional Radio. Looking forward to our next conversation.
Absolutely. Thank you so much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Thomas Slavin. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.